A third-party independent external review into the delivery of a stillborn baby at Victoria General Hospital last month is now public. And as Kristen Robinson reports, the review does make 21 recommendations on how things could be done better.
5 weeks after the Vancouver Island Health Authority commissioned an independent review into the case of Shirley Anderson's stillborn infant, half of the findings are being released publicly. In a 20-page system-level obstetric review, respirologist Dr. Ward Flemons finds Anderson's care was within time guidelines and there was no delay in anesthesia coverage. A detailed case analysis of the stillborn death will not be released.
It's tempting but impossible to look back and say, what if? And so the report doesn't try to draw conclusions like that. What we really were trying to do is use this case as a way to review the actual system and how it's structured right now in Victoria.
We wanted answers right on the spot, right? Why? How did this happen?
Erna Turry says she was in the VGH operating room August 9th when her granddaughter's baby developed an irregular heartbeat during the birth. She claims the baby was lodged in the birth canal for hours. Doctors tried suction and forceps before Turry asked why they weren't performing a cesarean.
She screamed back in my face because I don't have an anesthesiologist.
At the time, VGH anesthesiologist Dr. Sue Ferrara suggested a shortage of anesthesiologists may have been a factor. But Flemons' review found Anderson was quickly transferred to the main OR and treated by the on-site anesthesiologist. A C-section began 20 minutes after it was called, within Canadian guidelines of 30 minutes, and the backup anesthesiologist called in was not needed. Still, Flemons has 21 recommendations for the Health Authority, focusing on the need for team-based work between departments, including the creation of a maternal fetal health care program to define at-risk patients and establishing a dedicated obstetrical anesthesiology service.
Some simple communication tools, such as the whiteboard, and I think a case like this sensitizes everybody to improving the communication between two critical units that depend on shared resources.
Health officials are already working to implement all of the recommendations.